But here's our special offering, Insight Edge. Today, the focus is on Max Health. The stock is buzzing in trade. We actually had a chance to speak with the management earlier, and they were very optimistic about the increasing the number of beds, maintaining their return ratios, also the growth that they see overall in the business.
Yes, Sonia, in fact, Max has been delivering for multiple quarters now. So that optimism, I almost hear on a quarterly basis. But yes, the revenue was around 1,551 crores. The reported margins came in at around 28.3%, profit at 320 crores. It was the highest ever revenue and profit reported by this hospital company. Bed occupancy at 77%. They saw 3% addition in bed capacity in Q4. They expect another 300 beds to come on stream in the next 6 odd months. The EBITDA per bed has come in at around 70.3 lakh, which is an improvement on a Q-on-Q basis. They expect their average revenue per occupied bed also was at around 70,700 rupees. That too was an improvement on a Q-on-Q basis. They are expecting to see an increase in the EBITDA going forward. And the EBITDA margin for incremental beds, in fact, for the company came in at 25%. Strong operational improvement this time. International patient revenue was up 43% year on year. It's now 9.1% of their total sales. Institutional bed share, which is lower in terms of margins, was down to 29%. 30% of their beds are currently catering to that segment. They want to reduce it further. 1,281 crores of free cash flow was generated by the company, whereas Abhay Soy did mention that there was a lot of criticism initially in the hospital space that they are not able to generate free cash flow, but he has pretty much broken that myth, and they said that they won't shy away from leveraging themselves at even 2.5 times EBITDA in order to grow probably inorganically. We did speak to the management. We did speak to Abhay Soy. Let's listen to what he had to say.
We've had a 77% occupancy, but we've also opened 100 new beds. So that's about a 3% plus increase in capacity. So it's obviously 77% on a higher sort of this thing. Some of our beds are suboptimally utilized because of institutional business, and we'll be distilling those beds. So I think due to combination of these things, we don't have an issue as far as occupancy is concerned, at least 30% of our beds are catering to institutional business, which is less than 50% of our regular business.
Well, let's do one thing.